for patients as well as for physicians. Let's talk for a little bit about people who live with people with lupus, because part of the concern also is some of us walk around and we never complain. Other people complain all the time. Some people are right down the middle. Regardless, when we say something's going on, even though it's seemingly invisible, unless you're affected with that rash, it's got to be difficult for the people around lupus patients to handle this.
That's a great point. In fact, we have found that more often than not, some of the most successful support group meetings that we offer in, as I mentioned before, 15 different, what we consider chapters, if you will, throughout Michigan and northern Indiana, 6 of which are located throughout Metro Detroit. Some of the most successful and most beneficial conversations, if you will, around the support group table occurs when a lupus patient will bring their significant other, their spouse, their friend, to the meeting, because there is such a real dynamic that goes on when you are living with or supporting someone fighting this disease. And so, in fact, on our board of directors, we have 9 board of directors right now, hoping to grow that number, but 9 very committed, excellent board of directors who are completely engaged in what we're trying to accomplish as a nonprofit organization, 7 of whom are lupus patients. And they are, struggling with the disease and yet giving back their time amongst everything else that they have going on in their world, including their occupations and things that they're trying to do in their free time, and including trying to, get a handle on living with the disease of lupus. But 2 of our board members do not have lupus, and one is an actual rheumatologist in the Southfield area, actually, Dr. Larry Silverman, excellent rheumatologist. The other is the husband of a lupus patient, and his name is Josh Kirkbride, and he's CPA, and he actually serves as our treasurer. Does a great job at that, but provides a really unique input into the world of living with someone with lupus. And what's so fascinating on some of the stories that he and other folks have said is, when you're with someone, you love someone, living with them, supporting them, you really need to take into account what that person is dealing with, and have maybe a little bit extra empathy, a little more compassion than you typically would have. As you said before, a lot of us have up good days and bad days, and we deal with it in the best way we can. But when you are trying, whether it is lupus or some other disease, there are obviously many folks struggling with things out there. Just going into your day, working with that person, living with that person, having some type of relationship, and having just that little kernel extra of empathy, compassion, and understanding for what they're going with. Right. Boy, it not only helps the person going through the disease, it can help you to really, get through your program, your day in and day out routine, just a little bit easier with a little more, understanding and awareness of overall what folks are dealing with out there.
Now, you mentioned that there is now the first drug to treat the symptoms of lupus, but so far there is no cure, correct?
That is correct. There is no cure. What we encourage folks to do is, if you are going through, as I mentioned before, unexplained fever, skin rashes, sun or light sensitivity, different types of extreme fatigue, or chronic pain in your joints, boy, talk to your doctor. Bring it up as an option. There's actually a television show that now is off the air, but it's called House. And this medical professional used to joke multiple times on the series, saying, a new or different type of undiagnosed condition would come into the medical practice there, and he'd say, well, it's not lupus. For God's sake, it's not lupus. It's something else. Don't worry. Very rare does that happen. Well, that's good and bad for us, actually, because it does bring about some awareness, but it's not necessarily accurate. Sometimes, if those conditions persist in a person, it very well could be lupus.
Sometimes it is.
You just never know. It doesn't hurt to take a blood test and at least exclude that from the range of symptoms and the range of different treatment options that a doctor could have. But bringing about the awareness level, I looked to what a rheumatologist mentioned to me recently, that yes, 2 million people throughout the United States, or perhaps a little more, but at least 2 million have been diagnosed with lupus.
Yes.
Well, not very many people have a true understanding, or the awareness level needs to be heightened. Well, if you were to take, and again, this was said to me by a medical professional, I don't know how extremely to the numbers accurate this is, but in a broad sense, if you were to take these 5 disease types that I'm going to list off to you: multiple sclerosis, cystic fibrosis, AIDS, sickle cell anemia, and cerebral palsy. Together, combined, those 5 disease types don't amount to the number of diagnosed lupus patients in this country.
I'm shocked.
That is, it's pervasive, and yet those disease types, while very important to treat, and I don't want to discount them at all.
Of course.
They have much more awareness. Those groups, oftentimes the nonprofit organizations built to help fight those diseases and to create awareness and to find research dollars, have done, in our opinion, a better job than lupus organizations in creating exposure and awareness of that, because those 5 disease types seem to be in the public consciousness much more than lupus. And so therefore they generate more dollars to fundraise and find research to help create a cure for them. They generate much more awareness so that people have it on their radar to go get treated. And the doctors themselves are being educated on those disease types more and can hopefully diagnose those disease types. We need to bring lupus up to those levels to bring about more advocacy on its behalf.
2 questions. 1, is it hereditary? Is there an hereditary component? And 2, can you die from lupus?
Yes and yes. So it's not in every case that it's hereditary, but more often than not, something between the gene pool of parents will pass along something into the DNA structure of a person. However, again, it's not necessarily critical. Not every lupus patient had a parent with lupus. It can happen. It's not an exact science. It really is a very unknown cause as to how this came about. The second issue is, yes, unfortunately, it can be terminal and has been in a number of cases. Ranging from people in their teenage years all the way up through end of life. But it goes to show that, again, I use the term snowflake disease. So where it may take someone, in the most common occurrence, within 2 to 3 years, which is just devastating, of course, and terrible, a person could also live with lupus for 20, 30, 40 years. However, that particular existence then is not necessarily rainbows and sunshine. It's a very difficult disease to live with. So it's really not a good situation either way. However, we as humans, we want to do what is best for ourselves in the moment. Perhaps if a person diagnosed with lupus looked to an organization built and structured to help them cope and to identify the newest medications on the market that may or may not be specific towards lupus, but there are other drugs, prednisone for an example, that can help someone who's affected with this disease, perhaps looking to your organization, talking to your doctors, coming to a group like the Lupus Alliance of Michigan, Indiana, to help, if nothing else, cope with the disease better. To attend support group meetings, look to our website, milupus.org. Call our office. As I said before, we have 5 dedicated professionals every business day and oftentimes on weekends and nights that are just waiting to help you. And it's something that I think is very effective in the world. We just need to bring about the awareness and exposure level. And again, that's why I'm so pleased to be chatting with you this morning, Elisa.
Frank, before we close, we've got a minute or so left. Is all we have just for today, but you'll come back another time, I'm sure. Is there any stone we've left unturned? Is there any item you want to make sure we reiterate? For example, remember, you cannot contract lupus. This is something that you are born with, and it may or may not manifest, and we're still not sure what triggers it. But again, that's why there's so much need for research and funding to figure out this disease. So in the minute or so we have left, is there anything that you would like to mention one more time? Sure.
Again, just reaching out to your nonprofit organization, milupus.org, a wealth of information on there. We do have an excellent, what we call our annual symposium coming up on Saturday, November 10th in Troy at the Michigan State University Management Education Center. It's an all-day symposium. It's $10 for a person to attend. Very reasonable, but some excellent information will be presented. And I know we're short on time, but Robert Phillips, PhD, Dr. Phillips, we're flying him in from New York State. He has written over 30 books, including a book called Coping with Lupus and another book called Successful Living with Lupus. So we encourage anyone with questions or that knows someone or that is interested in learning more to attend that symposium. Again, that information can be found on our website, milupus.org.
Frank Mortl III, thank you so much for spending your morning with us.
My pleasure, Elisa. I really appreciate it and enjoyed the conversation. Thank you so much.
Once again, I'm Elisa Z. You're listening to the Sunday Edition.